About 18 months ago, we first started to talk about the PCSK9s. They have been in the news off and on ever since then, but finally we're starting to see some phase 3 data. So it's time for some updating. We're here with one of the principal investigators of phase 3, ODESSEY. It's a program that consists of 14 studies in more than 23,000 patients. And I'm with Dr. Eli Roth, MD, Medical Director, Sterling Research Group, Cincinnati, Ohio, and the lead investigator of ODESSEY Mono. Now, talk about the drug a little bit and about the results of this trial.
Okay, Alirocumab is a PCSK9 antibody that decreases the effect of PCSK9, which is to affect increased LDL receptors and lower LDL cholesterol. In previous phase 1 and phase 2 trials, we've seen LDL reductions of 50 to 70%, mostly on top of statins. The purpose of the ODESSEY Mono trial was to use a reduced dose of the Alirocumab. Instead of 150 milligrams, we went with a 75 milligram dose every 2 weeks, subcutaneous. And it was modeled to give an approximate 50% reduction in LDL cholesterol. We did this in patients who were moderate risk and who were not on any other lipid-lowering therapy. And we used as a comparator, half the patients received the Alirocumab, the other half received ezetimibe, 10 milligrams a day. And the ezetimibe at the end of 24 weeks, it was a 24-week study, gave approximately a 17% reduction in LDL cholesterol, which is pretty much what is expected. The Alirocumab, depending on how you looked at it, gave a reduction between 47 or 54%. If you did intent to treat, which meant we used all the numbers for all the patients, even the ones who didn't take medication, it was 47%. If you looked at an on-treatment analysis, which just looked at LDL numbers of those patients who were taking their medication, then you got 54% reduction in LDL cholesterol.
Now, in terms of safety, what did you see?
The drug is very safe. It's consistent with what we've seen in the other studies, the usual types of influenza, upper respiratory tract infections. There were no laboratory signals, no abnormal CK or liver enzymes per se, really nothing out of the ordinary. So the drug was comparable between the Alirocumab and the ezetimibe.
Now, this is a subcutaneous. Is it handled in do they go to a center to get this?
No, this study actually was a self-injected with an auto-injector. It's a 1 cc injection, wow. And the patients were trained to use the auto-injector in the office, and then they gave themselves the injection for every 2 weeks for 24 weeks.
So where do you think this is going to end up? Assuming that there's an approval, what's the role that PCSK9s are going to have, do you think, in the future?
Well, because of all of the data that we have with statins, I think initially PCSK9 is going to be an adjunct to statin therapy. And probably the first indication or the first approval will be for heterozygous familial hypercholesterolemia patients who cannot get to reasonable numbers despite maximal therapy. Second indication will probably be for other patients who perhaps have elevated LDLs and maybe cannot tolerate the maximum dose but are taking as much as they can. And I think the Alirocumab will be an add-on to those patients.
Finally, in terms of this particular agent, has there been any analysis of the various subfractions of LDL so that you're knowing not just what LDL is doing, but what we're finding out that sometimes subfractions can be just about as important as LDL in general? Is there any knowledge along those lines regarding PCSK9s in general of the drug you're studying?
There have been some lipoprotein profiles done within the studies. Those haven't been reported yet to my knowledge. They're going to be in the future. But I think that the major components, the atherogenic components, are decreased significantly.
You've seen that consistently?
Yes, and generally when you reduce LDL to below 70, you're really reducing particle number and particle size to the point that it really doesn't matter what it is. It's pretty much non-atherogenic at that point.
Thank you, Dr. Roth. I appreciate your time, and I also want to remind everybody that we have a variety of reports from ACC.14, including a supplement to CardioSource World News, where I'm Executive Editor Rick McGuire.